One recent report that appeared in Wired suggested that the United States has suffered through other difficult votes, of course, from the fraud-ridden election of 1876, in which 101% of South Carolina voters turned out, to the hanging chads of 2000. COVID-19 presents a historic challenge, and snafus are inevitable, but the goal, as always, is to win voters' trust. There's a famous saying that the point of an election is to convince the loser that they lost, says Ben Adida, the executive director of Voting Works, a non-profit maker of open-source voting equipment. If you've convinced the loser, you've also convinced the public. With less than a month before the end of the extended election period, an unprecedented election is giving rise to unprecedented events and claims by persons who call themselves scientists, like the announcement by Nancy Pelosi that the president got infected because he did not wear a mask. For starters, unless you are a public health professional, it may even be illegal for you to be wearing a medical-grade mask, like in Virginia, where the nation's only doctor serving as a state governor may being caught in public wearing that highly valued item in a pandemic, a Class 6 felony. But what she probably means that the president got infected because he refused to wear a facial covering, which is still not consistent with the science. Any scientist is fully aware that a facial covering is only recommended by the CDC for source control, or for the purpose of preventing infected persons from infecting others. Hence, unless Speaker Pelosi is suggesting that the president infected himself by not wearing a mask, which is also ridiculous, it is not exactly clear that the House Speaker has any grasp on the science. But what would a pandemic be without the head of R&D at the NIAID, but who had the chance to spoof by Brad Pitt on the comedy show Saturday Night Live, which he called an honor, and who some claim to be the leading infectious disease expert. And, just recently, Dr. Anthony Fauci made the announcement that the White House hosted a super spreader event last month. The fireworks finale for the Republican convention? No, apparently, the infallible Fauci appeared to be referring to the Rose Garden ceremony to announce the nomination of Judge Amy Coney Barrett to the Supreme Court. His logic is impeccable, for perhaps a 3-year-old, claiming that President Donald Trump and several others tested positive for the coronavirus following the event. And he told CBS News Radio, "I think the data speak for themselves. We had a super spreader event in the White House, and it was in a situation where people were crowded together and were not wearing masks." Maybe that is what the leading infectious disease expert is calling science before an election, but even those not stuck in the present may recall that Fauci began his present job in 1984 as the director of the National Institutes of Allergy and Infectious Diseases, and was on the front lines at the height of the HIV/AIDS crisis in the early 1990s. This is an interesting parallel, because, as some may recall, just before the last presidential election, several stories appeared in the news regarding Gaëtan Dugas, the promiscuous, globe-trotting, sexually insatiable French-Canadian flight attendant, was alleged to have picked up HIV in Haiti or Africa and spread it to dozens, even hundreds, of men before his death in 1984. According to one unforgiving press account regarding the person vilified in the Broadway stage production, Angels in America, Mr. Douglas was once blamed for setting off the entire American AIDS epidemic, which traumatized the nation in the 1980s and has since killed more than 500,000 Americans. The New York Post even described him with the headline, "The Man Who Gave Us AIDS." Decades later, after the political debates have moved into the background, it was determined that Dugas did not deserve the reputation that he was given in the press, and, much like current report in the Wall Street Journal, about a novel coronavirus, some scientists are now claiming that the novel coronavirus was in America before it was claimed to have arrived in Seattle in mid-January, and has been running rampant and out of control ever since. How the nation's only physician serving as a state governor failed to notice this early spread is as troubling as his getting infected, despite assuring everyone in a pandemic that a one-ply cotton bandana would prevent penetration by a microbial particle like a virus. This is the same medical doctor who decided to build a larger haystack through voluntary testing at the beginning of the outbreak, rather than ramping up a tracer contacts operation to efficiently identify the prevalence of COVID-19 in the Commonwealth of Virginia. Yet, it was the now infected former Army surgeon Ralph Northam who had been very vocal about the president's disregard for science, who had echoed Fauci's warnings to the president about super-spreader events. According to Major Mike Webb, a former strategic counterintelligence officer on Fort Meade who helped to create the intelligence organization that WOB News claimed in April was supposed to have alerted the president last November about an emerging health threat to American forces in the Sino-Pacific theater, Fauci's claims are recklessly ignorant or maliciously insurrectionary, because anyone familiar with the super-spreader phenomenon knows that a super-spreader event is practically impossible unless there is a highly infectious pathogen that is enabled by having a low infectious dose. The first super-spreader to gain notoriety in history was Typhoid Mary, and her refusal to comply with what was then called public health guidance eventually caused her imprisonment, in addition to notoriety later achieved by Gaetan Dugas. Typhoid is caused by Salmonella bacteria, and at the same time that the AIDS controversy was catching fire, scientists working quietly in laboratories were finally coming to agreement that in a super-spreader event it is the low infectious dose that actually makes the devastating event possible for a pathogen like Salmonella that requires the transfer of less than 100 bacilli organisms. Around the beginning of the current century, attention turned to tuberculosis, another bacterial infection, in which it was determined that it takes only the transfer of 10 bacilli from one infected person to transmit an infection to another human being. But even in a super-spreader event, the pathogen requires a Typhoid Mary or index case to work the room, because his or her victims will not be able to infect anyone for at least another 8 to 12 hours after they have been sufficiently exposed to actually become infected. And, given these dynamics involved in super-spreader events, COVID-19 becomes one of the least likely candidates to set off such an event, because even the largest study of tracer contacts to date, examining over 3 million laboratory-confirmed cases of infection in India, found that 70% of infected people did not infect any of their contacts. 70% of infected people did not infect any of their contacts, while 8% of patients accounted for 60% of observed new infections, as reported by CNN. But, according to Major Mike Webb, one key finding in the report was the observation that while the role of children in transmission has been debated, we identify high prevalence of infection among children who were contacts of cases around their own age, tying the infection spreading event to a definite location, a consistent finding in multiple studies. Even the Assist Deputy Director for the World Health Organization found it particularly odd that, after examination of over 56,000 cases in China, they found less than 5% in secondary infections among tracer contacts, which is at least 4 times less than the flu, and he expressed great surprise that the infectiousness for COVID-19 appeared to trail off in direct correlation to the further they departed from ground zero for the outbreak in Wuhan, China. Memory loss has been noted as a symptom for COVID-19, and even Senator Tim Kaine was so impacted by his infection that he not only forgot to tell anyone that he had been infected in March, before making his announcement at the end of May, but also he apparently forgot to delete the pictures of him potentially infecting others during his sickness, a time which he now claims he was working at home, even though, despite, according to his account, not knowing that he had been infected. Nonetheless, some may recall the name of Larry Kramer, a long-time HIV/AIDS activist, who became the chief critic of Dr. Fauci. Was Larry Kramer in the late 1980s, as a founder of ACT UP, which remains hostile to this day. At least back then, Kramer blamed Fauci for failing to keep his promise to find a cure for HIV infection, accusing Fauci of permitting scores of drugs and alternative treatments to languish untested while more than 200 new cases of AIDS are diagnosed each day, and holding him responsible for the deaths of over 120,000 deaths to the AIDS disease and HIV virus. Major Mike Webb has consistently argued that the governor had failed to establish that a communicable disease existed, and that he had closed down the state even when the World Health Organization could not prove that one existed even after examining over 89,000 laboratory-confirmed cases. Moreover, Major Mike Webb has taken these arguments to state and federal courts against Governor Northam, who, since March, has adopted the peculiar defense strategy of evading the sheriff and the United States Marshal, conduct characterized as obstruction of justice. Major Mike Webb has further sought the assistance of Senator Mark Warner, the ranking Democrat on the Senate Select Committee on Intelligence, requesting that he investigate evidence of a deviant migration pattern that was early disclosed by the World Health Organization. The refusals to cooperate by both Warner and Northam have given rise to sufficient predicate offences to commence an action under the federal racketeering statute, and Major Mike Webb expects to file the action in Richmond shortly. So, in Virginia, regardless of what is announced in the news as the official tallies for the elections, unanswered questions linger like hanging chads in Virginia as to why the governor, Ralph Northam, made the peculiar decision to risk a felony charge of obstruction of justice to avoid being brought into court on his COVID-19 response, why the Board of Elections would not simply grant to Major Mike Webb the pandemic exception that it had granted to other candidates, and or even respect his due process rights to a trial on the merits, and finally how rounds of litigation, especially relating to the state lockdown orders and brought by a congressional candidate, never found even a mention in the press. These questions, currently stymied in the courts, may well create a significant challenge for certifying the vote in the cradle of the presidents and determination as to which presidential candidate finally receives its 13 electoral college votes. Stay tuned for more. Reporting from the battleground state of Virginia, in what will truly be an unprecedented election.
This advertisement was authorized by Mike Webb.